What if one of the most common healthy snacks in America is quietly sabotaging your kidneys, without pain, without warning, and without a single symptom until real damage is already done? Most people never question a handful of nuts. They're labeled heart-healthy, brain-boosting, and diet-friendly. But your kidneys don't read food labels. They respond to chemistry. And the truth is, certain nuts place an enormous hidden burden on aging kidneys, while others can actively protect and restore them. I'm Dr. David, and today I want you to stay with me until the very end, because the difference between kidney protection and kidney decline may come down to what you snack on tonight. This matters more than most people realize. Right now, over 37 million Americans are living with chronic kidney disease, and nearly 9 out of 10 have no idea it's happening. Kidney decline doesn't announce itself early. You can lose up to 40% of kidney function before routine blood work even raises concern. By the time symptoms like swelling, fatigue, brain fog, or shortness of breath appear, the kidneys are already under serious strain. That's why prevention, what you eat daily, repeatedly, without thinking, matters more than emergency treatment later. Every single food you eat sends instructions to your kidneys. Some foods reduce inflammation, improve blood flow, and protect nephrons, the microscopic filters that clean your blood over 400 times a day. Other foods overload those same filters with minerals your aging kidneys struggle to regulate, such as phosphorus, potassium, and oxalates. Over time, this overload raises creatinine, stiffens blood vessels, and accelerates scarring inside the kidneys. But here's the hopeful part. Food can also slow, stabilize, and sometimes partially reverse this process when chosen wisely. That's why today you'll learn 3 nuts that consistently support kidney function and 3 that look healthy but quietly work against you. If you care about protecting your energy, independence, and long-term health, this is information you don't want to miss. Number 1. Sunflower seeds. Sunflower seeds may seem like one of the most ordinary foods in the grocery store, but for aging kidneys, they can play a surprisingly important protective role when eaten correctly and in the right amount. As we get older, the kidneys slowly lose their ability to defend themselves against oxidative stress. Oxidative stress is a process where unstable molecules, often created by high blood pressure, diabetes, medications, and normal aging, begin to damage kidney tissue from the inside. The tiny filters in the kidneys, called nephrons, are especially vulnerable. Once these filters are damaged, they do not easily regenerate. Sunflower seeds are rich in vitamin E, a powerful fat-soluble antioxidant that helps neutralize this damage before it becomes permanent. Vitamin E supports the outer membranes of kidney cells, keeping them flexible and resilient instead of stiff and scarred. Studies involving older American adults have shown that regular intake of vitamin E from whole foods is associated with better estimated glomerular filtration rate, which is a key measure of how well the kidneys clean the blood. Another reason sunflower seeds are helpful for seniors is their effect on blood pressure and circulation. Healthy kidneys depend on steady, gentle blood flow. When blood vessels are tight or inflamed, the kidneys are forced to filter blood under higher pressure, which accelerates wear and tear. Sunflower seeds contain natural plant fats and magnesium that help relax blood vessels and improve circulation. This allows blood to move through the kidneys more smoothly, reducing strain on the filtering system. Many older adults notice that when kidney circulation improves, swelling in the legs and ankles may lessen, and overall energy can improve. Sunflower seeds also support the balance of sodium in the body, which is critical for people who have been advised to watch their salt intake to protect both heart and kidney health. What makes sunflower seeds especially valuable for aging kidneys is that they provide protection without overwhelming the kidneys with excess minerals when eaten in moderation. Unlike some other nuts and seeds, sunflower seeds are lower in phosphorus and potassium per serving, which matters because older kidneys have a harder time clearing these minerals from the blood. Excess phosphorus, in particular, can pull calcium out of bones and deposit it in blood vessels and kidney tissue, increasing the risk of stiffness and decline. A small portion, such as 1 tablespoon per day, is enough to deliver benefits without creating mineral stress. Eating more is not better, and portion control is key for kidney safety. Preparation also plays a major role in how well sunflower seeds support kidney health. Soaking them in warm water for 3 to 4 hours before lightly roasting or drying helps reduce phytic acid, a naturally occurring compound that can block mineral absorption and irritate digestion in sensitive individuals. When phytic acid is reduced, the body can better absorb vitamin E and beneficial fats, and the kidneys do not have to work as hard to process waste byproducts. Seniors often find soaked and lightly roasted sunflower seeds easier on the stomach and gentler overall. In practical daily life, sunflower seeds are easy to include without changing eating habits dramatically. They can be mixed into oatmeal, stirred into plain yogurt, sprinkled over cooked vegetables, or added to a small salad. This makes them realistic for older adults who want consistency rather than complicated diets. Over time, these small, steady choices help reduce inflammation, support healthy filtration, and slow age-related kidney decline. While sunflower seeds are not a cure, they act as daily support for kidneys that have worked tirelessly for decades. When used wisely, they become a simple, affordable way for seniors to care for their kidneys and protect their independence for years to come.
Number 2. Macadamia nuts. Macadamia nuts are often thought of as a luxury food, but for aging kidneys, they can serve a much deeper purpose when eaten in the right way. As we grow older, kidney tissue becomes more sensitive to long-term inflammation caused by high blood sugar, high blood pressure, and years of medication use. This inflammation damages the tiny tubes inside the kidneys, known as renal tubules, which are responsible for fine-tuning what stays in the body and what gets removed. Macadamia nuts contain a rare type of healthy fat called omega-7 fatty acids, especially palmitoleic acid. This fat helps calm chronic inflammation and supports the repair of cell membranes, making kidney tissue more flexible and resilient rather than stiff and overworked. For seniors, this flexibility is critical because stiff kidney tissue filters blood less efficiently and is more likely to scar over time. Another important benefit of macadamia nuts is their very low mineral burden compared to many other nuts. Aging kidneys struggle to remove excess phosphorus and potassium, which can build up in the blood and place extra strain on the filtering system. Macadamia nuts naturally contain much lower amounts of these minerals, making them one of the safest nut choices for older adults concerned about kidney function. This means seniors can enjoy their healthy fats without forcing the kidneys to work harder to clear mineral overload. In practical terms, this can help stabilize creatinine levels and reduce stress on already tired kidneys. Macadamia nuts also support kidney health by improving blood sugar control and insulin sensitivity. Blood sugar swings damage small blood vessels throughout the body, including those that supply the kidneys. Over time, this damage reduces oxygen delivery and accelerates kidney decline. The fats in macadamia nuts slow digestion and help prevent sharp spikes in blood sugar after meals. Clinical nutrition research involving older adults with early kidney impairment has shown that diets richer in monounsaturated fats, like those found in macadamia nuts, are linked with lower levels of protein leaking into the urine and better overall filtration rates. For seniors who are borderline diabetic or managing type 2 diabetes, this gentle blood sugar support can make a meaningful difference. Timing and portion size matter when using macadamia nuts for kidney support. A small amount, such as 5 to 6 nuts per day, is sufficient. Eating them mid-morning, about 30 minutes after breakfast, aligns well with the kidney's natural filtration rhythm and allows the fats to be absorbed gradually. Pairing macadamia nuts with fiber-rich fruits like apples or pears helps the body process the fats more efficiently and reduces digestive strain. Because macadamia oils are delicate, storage is also important. Keeping them in an airtight glass container in the refrigerator helps prevent oxidation, which can turn healthy fats into inflammatory compounds. For seniors, macadamia nuts are not about indulgence, they're about protection and balance. They act like a natural lubricant for aging cells, helping improve blood flow, reduce inflammation, and support the delicate structures inside the kidneys. When used consistently and in moderation, macadamia nuts can help aging kidneys work more smoothly and with less stress. Over time, this can translate into better energy, improved fluid balance, and a slower pace of kidney decline, allowing older adults to maintain independence and quality of life longer. Number 3. Pecans. Pecans are deeply rooted in American food culture, especially in the southern United States. But beyond their familiar taste, they offer meaningful support for aging kidneys when eaten with intention. As we grow older, one of the biggest challenges the kidneys face is reduced blood flow. The tiny blood vessels that feed the kidneys gradually become narrower and less flexible, forcing the kidneys to filter blood under higher pressure. Over time, this strain damages the delicate filtering units and accelerates kidney decline. Pecans are a natural source of magnesium, a mineral that plays a key role in relaxing blood vessels and improving circulation. When blood vessels stay relaxed, blood moves through the kidneys more smoothly, allowing them to filter waste more efficiently and with less stress. Magnesium deficiency is extremely common among older adults in the United States, often due to medications, reduced absorption, and years of processed food intake. When magnesium levels are low, blood vessels tend to stay tight, blood pressure rises, and kidney tissue becomes more vulnerable to scarring and calcification. Pecans help address this quietly and naturally. Research following older adults has shown that higher dietary magnesium intake is linked to slower progression of chronic kidney disease and better estimated glomerular filtration rate, which is a key indicator of kidney performance. In simple terms, magnesium helps the kidneys do their job without forcing them to work overtime. Pecans also support kidney health through their antioxidant content. They contain plant compounds called polyphenols, which help reduce inflammation inside blood vessels and kidney tissue. Chronic low-grade inflammation is one of the main drivers of kidney aging. When inflammation is reduced, the kidneys are better able to maintain balance in fluids and electrolytes, which can help reduce swelling in the legs, ankles, and hands that many seniors experience. Pecans provide this benefit without a heavy load of phosphorus, making them gentler on aging kidneys than many other nuts. Another advantage of pecans is how they support heart health, which is directly connected to kidney health. The heart and kidneys work as a team. When the heart pumps efficiently and blood pressure remains stable, the kidneys are protected from pressure-related damage. The healthy fats in pecans help improve cholesterol balance and support flexible blood vessels, easing the workload on both organs. For seniors, this combined heart and kidney support is especially important, as problems in one system often accelerate decline in the other. Preparation and portion size make a real difference when using pecans for kidney support. A small handful per day is enough to provide benefits without excess calories or mineral load. Storing pecans in an airtight glass container helps preserve their natural oils, and letting them sit at room temperature for a short time before eating can improve texture and digestion. When eaten regularly but moderately, pecans act as a calming influence on the kidneys, helping them filter blood with less resistance and more efficiency. Over time, this gentle support can help seniors maintain healthier kidney function, steadier blood pressure, and greater day-to-day vitality. Now let's talk about 3 nuts that harm your kidneys. Number 1. Peanuts. Peanuts are deeply woven into everyday eating habits across the United States, which is exactly why they can be so problematic for aging kidneys. From peanut butter sandwiches to snack bowls and protein bars, many seniors consume peanuts almost daily without ever questioning their impact. The concern is not just calories or fat, but the unique combination of toxins, minerals, and processing methods that place silent stress on the kidneys over time.
One of the most serious issues with peanuts is their high susceptibility to aflatoxins. These are toxic compounds produced by molds that grow easily on peanuts during farming, storage, and transportation, especially in warm climates. Aflatoxins are invisible and tasteless, meaning you cannot detect them by smell or appearance. Once consumed, they must be filtered out of the blood, a task that falls heavily on the kidneys. In older adults, whose detox and repair systems are already slower, repeated exposure can inflame kidney tissue and gradually damage the nephrons that filter waste. Beyond toxin exposure, peanuts also contribute to kidney strain through their mineral content. Peanuts contain significant amounts of phosphorus, a mineral that healthy kidneys remove efficiently, but aging kidneys often cannot. When phosphorus builds up in the bloodstream, it disrupts calcium balance in the body. This can lead to calcium being pulled from the bones and deposited in soft tissues, including the blood vessels and kidneys themselves. Over time, this process stiffens kidney tissue and reduces filtration efficiency. Many seniors are unaware this is happening because high phosphorus levels often cause no early symptoms, yet they quietly accelerate kidney decline. Another overlooked problem with peanuts is how they affect inflammation and blood pressure. Most peanut products sold in the United States are roasted in refined oils and heavily salted to improve taste and shelf life. Excess sodium causes the body to retain fluid, increasing blood pressure and forcing the kidneys to filter under higher pressure. Chronic high pressure damages the delicate filtering membranes inside the kidneys, much like high water pressure damages household pipes over time. Even natural peanut butter often contains added oils that promote inflammation, making it harder for aging kidneys to recover between filtration cycles. Peanuts can also encourage overconsumption because they're easy to eat in large amounts without feeling full. This leads to repeated mineral and toxin exposure throughout the day, especially in seniors who snack frequently to maintain energy. For individuals with early kidney decline, diabetes, or long-standing high blood pressure, this pattern can quietly worsen lab values such as creatinine and estimated filtration rate. The danger lies in consistency, not occasional intake. While peanuts may appear healthy on the surface, their hidden effects on aging kidneys make them a food that deserves caution rather than blind trust. Choosing safer alternatives with lower toxin risk and mineral load can reduce kidney stress and help preserve function as we age.
Number 2. Pumpkin seeds. Pumpkin seeds have earned a reputation in the United States as a clean and natural superfood, which is why they can be especially dangerous for aging kidneys. Many seniors add them daily to salads, oatmeal, yogurt, or trail mixes, believing they're strengthening their heart and hormones, never realizing the quiet strain being placed on their kidneys. The biggest issue with pumpkin seeds is their extremely high oxalate content. Oxalates are plant compounds that bind with calcium in the body. When kidneys are young and strong, these compounds are filtered out through urine. But as kidney function naturally declines with age, oxalates begin to accumulate in the urinary system. Over time, they form microscopic crystals that irritate kidney tissue and eventually grow into kidney stones. For older adults, this process is often slow and silent, with no warning signs until a sudden and extremely painful stone episode occurs. Beyond stone formation, oxalates cause chronic irritation inside the kidneys, even when stones do not fully form. These tiny crystals can scratch the delicate lining of the urinary tract and kidney tubules, triggering inflammation. Chronic inflammation makes kidney tissue stiff and reduces its ability to filter blood efficiently. This means waste products remain in the bloodstream longer, increasing fatigue, swelling, and mental fog. Seniors with already reduced kidney function are especially vulnerable because their kidneys cannot flush these compounds out as effectively as they once could. Pumpkin seeds also contain a concentrated amount of phosphorus. Phosphorus is a mineral that must be carefully balanced by the kidneys.
When phosphorus builds up in the blood, it disrupts calcium regulation in the body. Calcium may be pulled from bones and deposited in soft tissues, including kidney tissue and blood vessels. This process, known as calcification, hardens kidney structures and restricts blood flow, accelerating kidney decline. Many older adults never connect worsening kidney lab results with their daily intake of pumpkin seeds because phosphorus overload rarely causes immediate symptoms. Another hidden problem with pumpkin seeds is portion size. They're small, dense, and easy to overeat. Just a few tablespoons can deliver a heavy oxalate and mineral load that aging kidneys struggle to manage. On top of that, pumpkin seeds contain a significant amount of protein. While protein is important, older kidneys are less efficient at clearing protein waste products. Regular high-protein snacking forces the kidneys to work harder, raising creatinine levels over time. This added strain can be especially harmful for seniors with diabetes or high blood pressure, conditions that already stress the kidneys. What makes pumpkin seeds particularly misleading is how strongly they're marketed as universally healthy. Health blogs and food labels rarely mention oxalates, phosphorus, or kidney strain. This leads many seniors to trust pumpkin seeds as a daily staple rather than an occasional food. For older adults concerned about kidney stones, declining filtration, or rising creatinine, pumpkin seeds should be limited or avoided. Safer alternatives such as ground flax seeds or chia seeds offer anti-inflammatory benefits and healthy fats with far less risk to aging kidneys. Understanding this difference allows seniors to protect their kidneys without giving up nutrition, simply by choosing foods that match their body's changing needs.
Number 3. Almonds. Almonds are widely regarded as a superfood in the United States, often featured in breakfast bowls, smoothies, protein bars, and snack mixes. Many seniors incorporate them into their daily routine, believing they are supporting heart health, weight management, and overall wellness. However, for aging kidneys, almonds can quietly create significant stress that may accelerate kidney decline over time. The primary issue lies in their high content of phosphorus and potassium, two minerals that healthy kidneys manage easily, but aging kidneys often cannot regulate efficiently. When kidney function begins to slow, excess phosphorus and potassium accumulate in the blood, triggering a chain reaction of inflammation, mineral imbalances, and tissue damage that seniors may not notice until lab results reveal elevated creatinine or reduced filtration rates. Phosphorus, in particular, is a hidden danger in almonds. When blood phosphorus rises, the body attempts to maintain balance by pulling calcium from bones. Unfortunately, that calcium does not remain harmless. It deposits in soft tissues, including the kidneys and blood vessels, causing calcification and stiffness. Calcified kidney tissue loses flexibility, reducing filtration efficiency and increasing long-term risk for chronic kidney disease. For older adults, this process can accelerate quietly over months and years, even if they feel well and maintain other healthy habits. Potassium adds another layer of stress. High potassium levels can affect nerve and muscle function, including the heart, and force aging kidneys to work harder to excrete excess amounts. Even moderate daily consumption of almonds can tip this delicate balance, especially for seniors who already consume potassium from vegetables, fruits, and other nuts. Almonds also contain moderate levels of oxalates, compounds that can bind with calcium to form crystals, which, in susceptible individuals, contribute to kidney stone formation. This risk is compounded in older adults whose kidney filtration is slower, allowing oxalates to accumulate instead of being excreted efficiently. Many seniors unknowingly combine multiple risk factors by consuming almond milk, almond flour in baking, or multiple servings of raw almonds daily, further overloading the kidneys with phosphorus, potassium, and oxalates. What makes almonds especially deceptive is the superfood marketing surrounding them. They are promoted as universally healthy, but in the context of aging kidneys, regular high intake can quietly create cumulative damage. The problem is not almonds themselves. They are nutrient-dense and provide beneficial fats,
but how the body's ability to process their minerals changes with age. For seniors who want to protect kidney function, safer alternatives exist. Walnuts, for example, contain omega-3 fatty acids, antioxidants, and significantly less phosphorus and potassium, making them easier for aging kidneys to handle. Moderate portions of pistachios or macadamia nuts can also provide healthy fats without the mineral overload. The key takeaway is that healthy does not automatically mean kidney safe. Seniors who are mindful of phosphorus, potassium, and oxalate intake can protect kidney function, reduce inflammation, and maintain energy and vitality while still enjoying nutrient-rich foods that truly support their body's needs over time. Making informed choices about almonds and other high-mineral nuts can be one of the most effective daily strategies to preserve kidney health and independence well into later decades. Final takeaway. Your kidneys have been quietly working for you every single day, filtering toxins, balancing minerals, and keeping your body alive and energized without asking for anything in return. But here's the truth. The wrong foods, even ones you think are healthy, can silently wear them down, while the right choices can give them a second chance to heal and thrive. By swapping in kidney-friendly nuts like sunflower seeds, macadamia nuts, and pecans, and avoiding hidden dangers like peanuts, almonds, and pumpkin seeds, you can slow kidney aging, reduce inflammation, and protect your energy and independence for years to come. Every bite matters. Your kidneys notice more than you think. Now, here's what I want you to do. If you found this video helpful, hit that like button, share it with a friend, parent, or loved one who needs this information, and make sure you hit that subscribe button and turn on notifications. Every week, we bring you simple, science-backed tips to strengthen your kidneys, lower creatinine naturally, and keep your body feeling younger and healthier. And don't just watch. Comment below and tell me which nut you're going to add or remove from your diet starting today. One small change now can protect your kidneys for decades. Don't wait. Your body will thank you.